People with Medicare need to make an important decision before December 7th as they work to identify the best plan for their individual health needs. So joining us with advice on how to get started is Catherine Field, Senior Vice President and Medicare Division Leader of Humana. Thanks for joining us.
Thank you for having me.
So for maybe people who haven't had to deal with this yet, or maybe, we just kind of want to give a refresher to people, what's the difference between original Medicare and Medicare Advantage?
It's such a great question, and they really sound a lot alike, but they are quite different. So original Medicare is the government program that provides health benefits to those over the age of 65 and those who are disabled. It includes your hospital benefit and your outpatient service benefit. Medicare Advantage are those same services and the same program, but administered through a private health insurance company. There tend to be a couple of key differences. One is that Medicare Advantage plans typically offer predictable copays. They offer maximum out-of-pocket protection, so you know how much you'll pay max over the course of a year. And then finally, they offer a lot of extras that original Medicare does not cover, like dental, hearing, vision, over-the-counter benefits, sometimes a gym membership, and often include your Part D or your prescription drug plan, which original Medicare does not cover.
Right, so then what should folks keep in mind when choosing a Medicare Advantage plan?
You know, it can get a little overwhelming. There's a lot to think about, but we really recommend thinking about three things. The first is, what do you spend your healthcare dollars on today, and what do you anticipate spending them on in the future? The second is really, are your doctors, the physician you go to, your specialist, your hospital in the neighborhood, are they in network for the plan you're considering? And then finally, what do those extras really resonate with you? Maybe you love that idea of a gym membership, or maybe you've stopped driving and a transportation benefit is really important for you. So if you've done a nice, strong needs assessment up front, I think you'll find yourself in a plan that really meets your needs and makes you happy through the year.
Yeah, that's interesting. I didn't even know that could be, an option, gym membership for some. That's really neat. Some seniors, though, have had to choose between food and medicine. What can people do to ensure that their meds and their doctors are going to be in their plan?
Yeah, it's really important. And these things change every year. Formularies change, in-network providers change. So we really recommend take a look early in the season. So if those things have changed, you can assess what is going to maximize your benefit. Tools like Medicare.gov have a tool that you can enter all your medications into. You in your area, which plans maximize your prescription drug coverage. The same is true of the plan finder tools that are on each of the insurance company websites like Humana.com. You can enter your physicians and you can see if they're in network for the plan you're considering.
Okay, and beyond the basics, are there any examples of innovative benefits that eligible individuals should be looking for?
Yeah, again, every year there's just new and different benefits that really meet the needs of this population. One of the things that we added to some benefits or plans last year, this year we've really expanded, is the insulin savings program. This is a program for folks that are living with diabetes that covers their insulin at a very predictable $35 a month. And so if folks are living with diabetes, they may want to consider a plan that has the insulin savings program on it. Another innovation that we've are proud of here at Humana is we've seen over the course of these last 18 months of many seniors in particular are reaching for online tools to help solve their healthcare needs. 30% of those folks polled found that they were using a virtual visit to access care. So for 2022, all of our primary care, urgent care, and outpatient behavioral health virtual visits will have a $0 copay. So increasing access to those kind of services without folks having to leave their home. And then finally, we've got some really great plans that are tailored to the needs of a veteran. Now, veterans can buy any plan they want, and anybody can buy this plan. But these plans have really strong dental benefits that those who are accessing VA benefits might not have. And so veterans and folks that have served our country may want to look for what we call an honor plan at Humana. So those are just a few things that we're particularly proud of this year as we think about 2022.
Well, and I like how you mentioned too the teledoc kind of service because of course the pandemic is still top of mind for many. So other than, visiting their doctor through the internet, if you will, through Zoom or something like that, and, getting information through them, is there another way that we can safely and securely get information before their December 7th deadline?
Yeah, there are lots of both, virtual seminars and ability to meet with a licensed agent. The agents are certified in selling Humana or in selling Medicare Advantage plans, and so you can easily access virtual seminars, virtual visits with these licensed sales agents. Certainly, Humana.com is a great place to register for that kind of an appointment. And certainly we have folks that are coming out, meeting with folks in a socially distanced, appropriate manner. So lots of ways to get information through Medicare.gov and Humana.com, but also with a licensed professional.
Thank you. And yes, virtual, that was the word I was looking for. It has been such a pleasure. Thank you for this information. It's going to help a lot of people.
My pleasure. Thank you for having me, Jordan.
Of course. And if you'd like to see this segment again, head on over to firstcoastliving.net.